Hey everybody, how are you guys tonight? Happy Monday. I'm not on live tonight because I'll be traveling in my car, and so I wanted to take this video real quick and go ahead and upload it so you guys will have it when you hop on for Monday's typical live video of Cornerstone's Pet Tip of the Week. This week we are continuing with the trend of one of the top 2 diseases that affects our pets in America today. So last week we started part 1 and we talked about obesity. Obesity and periodontal disease are the top 2 diseases we see in our pets. If you want to know more about dental or periodontal disease, you can definitely check out some of my prior videos. You can find them on our Facebook page right here where you're logging in to watch this video. You can also do it on our YouTube channel, Cornerstone Animal Hospital, or you can go to our website at cornerstonevet.info, go to the About section, hit videos, and then there will be a link that says Pet Tips, and that will have all the videos that we've done since we started this channel. But anyway, going back to what we were originally talking about, obesity. It's a big problem in our pets. As we talked about last week, it can have drastic effects on them and can decrease their quality of life and actually shorten their lifespan. Studies have shown they can shorten lifespans with obesity alone by 2 whole years. That's over 700 days, guys. That is a long time. 2 years is a long time. So we want to make sure that we are actually making sure that our pets stay healthy in a healthy weight. So how do we do that? Exercise and nutrition are the top 2 ways to do that. And so when we're talking about nutrition, you know, there's so many different brands of dog foods out there. I'm sure I feed grain, no grain, raw, what. My recommendation is to do a well-balanced diet. And so my recommendations tend to be Purina Pro Plan, Royal Canin, and Science Diet. Those are the top 3 diets that we recommend you guys using, and it just has a very good, well-balanced diet for you all to use. When it comes to exercise, guys, these guys need exercise just like you and I do, okay? I will tell you, when it comes to our arthritic patients, it is better to do frequency is better than length. And what that means is it's better to walk your dog for 10 minutes 3 or 4 times a day rather than taking your painful arthritic dog out to walk for 40 minutes. They just do better. Other things you can do is definitely swimming during the summertime, helps with arthritic patients, helps them to lose weight. Anything that we can do to get these guys moving. When it comes to our cats, you know, it may be using a laser pointer or using one of their feather toys to get them to play and run around more. But getting your pet to exercise is going to be key to helping them lose weight. In general, when you look at the back of the bag of whatever food you are feeding, there's going to be a weight chart, okay? And the important thing to recognize is that if your dog is in the majority, or your cat's in the majority of animals that have been fixed, meaning they're spayed or neutered, they actually do not need as many calories as that bag suggests, okay? So that bag, those calories are calculated for intact animals, those animals that have their reproductive system. Once you remove the reproductive system, you don't need the calories to maintain it. So what I recommend is feeding 3/4 of whatever, or 75% of whatever the lowest end of the range that they recommend for the ideal weight. The ideal weight is important. If you feed your pet, if you feed yourself the number of calories you need to maintain 200 pounds, then you're going to maintain 200 pounds. And your ideal weight may be 150 pounds or 120 pounds, whatever your weight is, whatever your pet's ideal weight is. You want to make sure you feed appropriately for that. So that's just some kind of tips for you guys as you're going forward with this food. Next week we are going to continue to talk about this, but we're going to talk a little bit more about some alternative methods to try to help you guys out. So all right, you guys have a really great day, and we'll talk to you later. Bye-bye.